We are on MCA TV. We are at GENS 2019 with Professor Greisen. He's a professor of pediatrics and consultant neonatologist at Julian Marie Centret in Copenhagen. Welcome.
Thank you.
In your opinion, what are the important research targets for improving neonatal care at the moment?
Well, I think there are two major agendas. One is to find the new ways to improve and to cure the sort of the problems that newborn infants are into. It could be preterm birth, it could be a difficult delivery, an injury, and it could be malformation. And all these, we have ways of treating, but we also know there are limits to what we can do. So one target is to really find new groundbreaking ways of treatment. But another target, that is to be certain if what we do is really the best possible. And we have a lot of things we do or do not, depending on what we think, where we actually do not have the knowledge whether this is valuable or not. So we have a huge research agenda in testing, refining what we are doing and tailoring that to precisely. And that requires large-scale trials. And this is not groundbreaking. This is just doing what we're doing now in a more precise way. And in order to do this research, we need to collaborate. We need to collaborate very widely. We need trials including thousands of patients. So that really is a goal for us as a professional society and also here as a conference where we are colleagues and clinicians who meet. How can we organize our work so that we will gain this knowledge to improve the use of the tools we have?
Okay, and about ethics in medicine, which are the main questions concerning research in ethics?
Yeah, we have, out of a very difficult history in Europe, obviously a strong focus on protection of the individual. And the protection of the individual, that is the informed consent in research ethics. And that is a universal right that you are asked for consent. The conflict or the problem is that this consent has to be informed and it has to be voluntary. And when we come to newborn infants, the newborn infant can't answer, so we ask the parents. And the parents' problem is sometimes they are in acute situation, acute distress. Sometimes they're not even there. Mother may be anesthetized, the father may not be there. And what we ask is obviously a complicated question because every research project has its potential benefits and its potential risks. And we need to give that information in a very difficult situation. And the parents have the very difficult problem of deciding not on their own behalf. Because I so often heard parents saying, if you were just asking if you could do this on me, it would be easy. But now I have to take responsibility for this child which I just got. And I have to agree with my husband or my wife, and we will have to sort out because we didn't yet really become parents, and now we have to decide on behalf of that child.
Yes.
This is a very difficult situation, and therefore I think the most important research ethical question here, that is, to which degree can we moderate this process so we get a fair deal for the child and for the parents and for the future children, obviously, who are to benefit from research, because they are not in the room, but they are obviously those who will benefit in the future if we are successful and get answers to the question we pose.
And I think the communication with parents it's very difficult, but can be improved.
Yeah. Extremely important. So the human relation is extremely important. Confidence, trust is extremely important, and the kind of consent and information, level of information during daily clinical care is a kind of also related to the kind of conversation you have when it comes to research questions. This is extremely important, and therefore we need to discuss this broadly in the scientific community, in the community of parents, in the society at large. It's really you can say it's a true dilemma because there is no final answer to this.
Thank you very much.